Chapter 31, Serious Mental Illness. So this seemed like a logical chapter to combine with our chapter on schizophrenia. Individuals with severe mental illnesses, which would include illnesses like psychotic illnesses and certainly the bipolar 1 or bipolar 2 disorders, usually present with difficulties in multiple areas of functioning, often associated with issues of poverty and stigma and unemployment and inadequate housing. They are certainly at increased risk for premature death, as we talked about, homelessness, incarceration, underemployment or unemployment, and substance abuse. Also poverty, and typically can be victims of crime and often report a lower quality of life in general. Often these people have feelings of isolation that result from loss of family and friendships. So issues confronting. Well, often establishing a meaningful life is difficult. They often have comorbid conditions such as physical disorders such as hypertension, obesity, coronary artery disease, and diabetes. And on average, as we talked about, die 25 to 27 years earlier than the general population. Also, depression and suicide are often comorbid conditions because these people may have a profound sense of loss regarding pre-illness life and what the potential for their life could have been. Substance abuse, very common, occurs in 50 to 60% of all people with serious mental illnesses. There are social difficulties, big one being stigma, of course, that can cause shame and anger, isolation and loneliness, and victimization. More issues, economic challenges. With unemployment and poverty, 85% of individuals with severe mental illness are unemployed. So housing instability and caregiver burden can also be economic challenges. Treatment issues, definitely non-adherence or non-compliance is a way we can say that as well. And if you look at box 31-1 on page 588 of your book, you can see interventions that can prove treatment adherence. Anosognosia, which is a very big word that means the illness itself often prevents people from recognizing that they are ill. So people with psychotic illnesses, or say that are manic or hypomania in their presentation, can suffer from anosognosia, which means they don't have any realization that they're ill at all. They believe that they are functioning just fine. Another treatment issue is medication side effects, treatment inadequacy, residual symptoms. So that means despite being treated, their symptoms are not fully and completely resolvable. And of course, another issue is the tendency for relapse, and that these illnesses are chronic, and certainly there is a sense of loss on the life that they could have had, should have had, loss in relationships, loss in independence. So there's a great deal of loss that accompanies these illnesses as well. So resources for those with severe mental illnesses, well, comprehensive community treatment. The goal is to improve the consumer's ability to function independently and achieve a lasting quality of life. And this is achieved through case management, through day programs, through crisis intervention services, through emergency psychiatric services, through group and individual therapy, psychotherapy, through housing services, partial hospitalization programs, which we do not have in Alpena, by the way, partial hospitalization programs. You really have to go to larger metropolitan areas to find such programs. Certainly guardianship and conservatorship, and these two terms. Guardianship is about the person. So guardians make decisions for the individual, healthcare decisions, housing decisions, etc. Conservatorship is about money. So a conservator is managing that person's money for them. So that's the differential between those two. And then certainly other community outreach programs such as meals and laundry services and social activities, transportation, housing, and substance abuse treatment for people who are dual diagnosed. And whenever you hear somebody referred to as having a dual diagnosis, what that means is they have a severe mental health diagnosis in addition to a substance abuse diagnosis. So our evidence-based approaches to treatment, well, Assertive Community Treatment Act has been shown to reduce inpatient admissions, incarceration, and homelessness. Cognitive and behavioral therapy, cognitive enhancement therapy, which is where you incrementally challenge functions such as being able to help people focus attention, help them process better, and help them recall information better. And you'll see I have this fourth point bolded, family support and partnerships. It's one of the strongest predictors of recovery. What we often see in the population of people that have severe mental illnesses is over time the family has disappeared and the friend support has disappeared. And you cannot blame the family or friends for that because you have no idea what their life is like. But we know that over time, people with severe mental illnesses are severely lacking in family support and partnerships. So another approach to treatment is to build those kind of supports again, and those are done through community mental health programs such as Light of Hope Clubhouse that all of you will experience, such as drop-in centers. We have a drop-in center here in Alpena called the Bayview Center, where people can establish a social network. Very important. We all need that. Also, social skills training, where you help people to develop interpersonal skills, socialization skills, and communication skills. Also, supportive psychotherapy and vocational rehabilitation are the Light of Hope Clubhouse, which not only helps people with socialization, not only helps people develop a social group, but they learn vocational skills so that they could potentially be employable, and promoting independence by that means. Money equals independence, as we all know. That's why we got jobs when we were 16. Money equals independence. Interventional strategies. Empowering the patient is the focus of interventional strategies. Involving patients in goal setting increases the likelihood of adherence. So if that person has a say-so in their treatment, they are more likely to adhere to that treatment, which is what that means. And also emphasizing quality of life issues to focus on the patient rather than on the illness. And as we talked about in the previous slide, developing and maintaining relationships. This is the key to treatment adherence, so compliance, and overcoming anosognosia. And supportive psychotherapy focuses on the here and now and helps with effective coping mechanisms. More interventional strategy, while aiding effective reality testing to enable consumers to recognize and counter hallucinations and delusional thinking is a big interventional strategy. Helping people to recognize and respond to stigma in appropriate ways. And certainly support groups and activities which increase social skills will reduce isolation. Education is key to reduce incidents of victimization, and also education is vital to help people with medication and treatment compliance. And if we look at the whole person in our view of care, we are reducing high morbidity and mortality rates, hopefully, and involving people in dual diagnosis groups. So people who have a diagnosis of a severe mental illness in addition to a substance use disorder, and getting them in those kinds of treatment groups through community mental health. Our final slide focuses on current issues, and these issues maintain items of discussion and debate, maybe even legal imperatives. One is mandatory outpatient treatment, so treatment that is mandated by court. This still continues to be a debatable issue in that it flies in the face of autonomy totally. But we also know that these treatment orders, mandated treatments, are to protect that person. So it's really balancing individual rights with the imperative to help people who may not be able to make decisions on their own. We know that criminal offenses and incarceration often go hand in hand with mental health disorders, that the mental health disorders may have tripped some type of criminal offense, and now the person is in jail or in prison. And imprisonment can certainly lead to victimization, despair, and relapse due to the distress of that. Advocates support diversion from jail to clinical care, and hopefully that always occurs appropriately, that somebody isn't in jail because they are currently experiencing a mental health crisis. If so, they should be in inpatient care in a place like Point East. And then there's the ongoing discussion about trans-institutionalization, that although we deinstitutionalized starting back in the 1960s, 70s, a lot of people will say all we really did was shifted people and populations from one kind of an institution to another. Really what they're talking about is maybe we transferred a lot of people from psychiatric institutionalized care to prison type institutionalized care. And that is an ongoing debate. So this concludes this chapter, these two chapters on schizophrenia and severe mental illnesses, and hopefully this helps you understand some of this information a little bit better.